We are very proud to invite Dr. R.V. Ashokan, the IMA National President-elect, to launch the QPMBA website and deliver his talk on, so it will be done, and deliver his talk on empowering private healthcare. So your words, please, sir. We are listening to you.
Launching. Devin, how do you launch? Okay. Thank you, Devin. President of QPMBA, Dr. Jose Matthew. President of IMA, Kerala State Branch, Dr. Sulfi Nuhu. Our chief guest, Sri P.H. Kurian, IAS. Dear Dr. Manojan, Sri Murugan, Dr. Muhammad Arif Khan, Doyen of Medical Profession and 5 times IMA State Secretary, Dr. Sabhabati, my very close Dr. O. Baby, Dr. C.M. Abubakar, Dr. T.P.V. Surendran, Dr. Wahab, and my dear members of QPMPA and guests. QPMPA for me is my home. I'm a QPMPA member. I started my medical activism from QPMPA, 90 to 92 as joint secretary, and 92 to 94 as vice president. It's to the credit of Dr. T.M. Paul, who I acknowledge the leadership initiation to Dr. T.M. Paul. And we used to spend a lot of Sundays in the Lotus Club and City Hospital with Dr. O. Baby, Dr. Sabhabati. So those things have been the initial inputs that have come in. Regarding the relevance of QPMPA, that's going to be my talk also, because empowering private healthcare will ultimately why we should empower QPMPA. There is a space which is unoccupied. This space has to be filled by only QPMPA. This space has to be enlarged. Very unfortunately, this space is shrinking. The space for private healthcare, which we have in mind, it's not the industry that what we see now. The private healthcare, as we see, this organization started as an organization of private doctors, essentially doctors, later incorporated the hospitals. Because it was the order of the day. There were hospital entrepreneurs in doctor community also. So QPMPA, to be relevant to the current situation, also become an organization of hospitals. But primarily it's an organization of private modern medicine. That is why the qualified. The Q, often we don't understand what it is. So do you differentiate from other, at that point of time? It's one of the very organizations, it goes into 50 years now. So QPMPA has a space, has a responsibility, and it needs to expand. As Dr. O. Baby pointed out, the doyens of QPMPA are all here, but it's for the younger generation to take it up. Not only for the medical profession, it's also the question of medical profession is also the question of the health for the people. Today, the leadership in health doesn't belong to doctors. The face of the health always will remain doctors. But unfortunately, doctors or employees. The industry has taken over. Very unfortunately, it's not only one industry, industry begets industry. So hospital industry begot hospitality industry, and it was very easy to find an industry in health insurance industry. So, industry begetting industry, all three coming together for profit. Very unfortunately, it's based on a patient care, and you don't make a profit out of misery. So the leadership going from medical profession to an industry is a catastrophe that has happened in the healthcare. At least in our country, Devin said you should also talk about the image of the medical profession. The image of the medical profession is the sins of the industry visiting the medical profession. Medical profession has not gone anywhere. The image of the medical profession, the ethics of the medical profession, the etiquette of the medical profession, they remain the same. The ethics and etiquette of medical profession is the story of the civilization of man. It's the finest, refined, civilized etiquette of the entire mankind. You cannot really disown it. But the problem is, health has been given away to industry. The profession has been replaced by industry. It all started with a for-profit hospital in 1985 because the government vacated healthcare. The government gave space. And you look at it from 1985, in 1993, the Supreme Court had no qualms to call the patient a consumer. Our Honorable Chief Guest also mentioned a consumer, and he defaced us, the doctors, as healthcare providers. These are terms which we don't agree. We will never agree our patient is a consumer. It will be to the eternal shame of the Supreme Court to have called the patient as a consumer. We cannot go back in time, but these are the stones which turned towards the industry. You look at violence. When did violence start? Violence started after for-profit industry and the consumer judgment of the Supreme Court. I hold the for-profit industry and the Supreme Court of India being the reason for turning the healthcare in this country and for the violence that is happening today. I'll be quick because Devin has said that I have only 5 minutes. Now that's about the industry, but what we look at, because at least in Kerala state, what is relevant? It's extremely rare to have doctor entrepreneurs. It disappeared in US in the late part of 19th century. It disappeared in Europe. It has disappeared in Southeast Asia. It lives only in South Asia. It lives. What? Hospitals run by doctors. It's an asset. It's not a liability. It's an asset because doctors running a hospital is run on medical ethics. What is the ethics for a hospital? What is the ethics for a for-profit hospital? Is it defined? Is there a code of ethics for a for-profit hospital? So what I would like to say, that we all, not only from the profession, the community benefits when a doctor starts a clinic, when a doctor starts a hospital. This fact is irrefutable. What could be helped? At least in our state, what has been observed, the statistics shows, before 20 years, there were 1,950 private clinics, institutions, hospitals, not clinics. The total number of beds at then was 60,000, 66,000, between 60 and 66,000. Before 10 years, it fell into 1,450. Today, Image has statistics that these hospitals have fallen below 1,000. 1,000 hospitals have disappeared in a span of 2 decades. Amazing. The number of beds has not gone down. It's 68,000. What does that mean? It means selective destruction of disappearance of small and medium hospitals. Who are they? They are doctor-run hospitals. In my own town of Punalur, no doctor has opened a single clinic or a hospital for the past 25 years. I settled there before 40 years. I am sure this is the same story in every town of Kerala. Then a time will come when you will have government hospitals on one side and for-profit hospitals on other side. No option. This middle sector is very important. That's the space that I am talking about QPMPA. The government doesn't recognize. They don't care. They don't care. They don't understand also. If they had understood, will they create a regulation like Clinical Establishment Act where they treat the for-profit hospitals as well as the doctor-run small 20-bedded hospital on an equal footing? Are they not fools? It's an injustice. Because whatever is happening in Kerala, the disappearance will only increase. It will not decrease. Clinical establishment is the death knell for the small and medium hospital, especially run by doctor-run hospitals. Either it has to be withdrawn or at least exempt small and medium hospitals, 50-bedded hospitals, from the death knell of Clinical Establishment Act. They will not survey the hospital. Doctors will not prefer to do it. Why should they do it? They can as well be 9 to 5 blue-collar employees. What the hell will fall? Will heavens fall? Doctors and doctors' families will live their life safely. It's for the people. It's for the inspiration and the aspirations of the medical profession that doctors run hospitals. The leadership inside a doctor. That is what brings a 700 plus medical colleges in India. 700 plus medical colleges. 1,08,000 MBBS graduates. In 10 years' time, you are going to have another 10 lakh unemployment. One of the important things will be to find a job. I am so happy that you are creating a job portal. I am also happy to inaugurate that. It's important to see that our children who are doctors, who are modern medicine doctors, are cared for, provided for, with employment. If necessary, we should facilitate their export to the entire world. We will look after the global health. So I am looking at QPMPA to reverse this trend. I don't know whether it is possible. All the forces, whether it is economical or political forces, are arraigned against the profession and the people. People don't care, people don't realize. But it's the people who are losing. So I am sure energizing QPMPA will energize the entire healthcare. We have a responsibility. I am sure all of us can share this responsibility to reinvent QPMPA. Let us see how many youngsters take it up. See that our new clinics come up, new hospitals come up, quality assurance, and how to start one. Let us handhold them to do that. I wish the QPCon very well organized by Devin, a powerhouse of modern medicine. I am so proud of him that he is able to hold an entire conference. Congratulations to you, Devin. I declare the job web portal inaugurated. Thank you so much.